Okay, so UAs, which is short for urine analysis, is a good, easy way to detect if there's anything going on with your patient. Okay, so we're going to go through some things here, and ideally what you have is a chem strip. Okay, so it's a long, probably about 3 or 4 inches long, depending on the brand and the company you use. And on that strip, there's different pieces of material that respond after you dip it in urine, and they change color. Okay, and then you put that color against a graph to let you know if there's any positive findings. Okay, and then you just simply record your findings. All right, so first of all, the urine does have a pale yellow, okay, or a yellowish color to it. Okay, and that comes from urochrome. And urochrome is a pigment that comes from the breakdown of hemoglobin. Okay, whether it's from bilirubin or bile pigments. Okay, and then some of that is going to pass through the kidneys and end up in the urine. Okay, so as a general rule, the color is a yellowish color. Okay, there are things that can influence the color change. So medications, certain foods, food colorings, and dyes can change the color of the urine. Okay, another thing would be odor. Okay, so urine does have an aromatic smell, an ammonia-like odor, but when it's there's an infection or there's some sort of disease process going on, the smell is more foul. Oftentimes, that's also accompanied by cloudy. The color, the appearance is very cloudy. Okay, diabetics can have a fruity smell, and that's because of ketones. So elevated level of ketones in the urine can give it a fruity smell. Okay, another thing to test for, so in other words, up here you have a visual, okay, just looking at it to look at the characteristics, and then you would make your marks on your notes on the odor. Okay, the pH, this is an actual test that comes from the dipstick. Ideally, now I'm going to modify this here. Ideally, you actually want the urine to be 6.5 to 7.5. Okay, so that must be taken within a few minutes after void. Okay, after they urinate in a special cup. If you want to get the most accurate pH, it needs to be done within a couple of minutes. Okay, because the longer the urine sits there, the more the pH changes just by simply sitting there. Okay, closer to 0 is not good, or the closer you get to 0 is not good, the closer you get to 14 is not good. So you can be too acidic or too alkaline. So ideally you want to be 6.5 to 7.5. It can be as lenient as 6.0. Okay, 6.0 to 7.5. So diet does influence the amount of acidity. Okay, if they have a high protein diet, that can change the acidity. Okay, if they're more on the vegetable diet, then they can have a more alkaline measurement. Okay, and that if you wanted to dive into more of that, there's this thing called the ORAC scale, O-R-A-C. Okay, ORAC, O-R-A-C, and that is an online like self-education program to help you with consuming more alkaline foods and staying away from acidic foods. Okay, so it breaks all that down for you. And the advantage is that if the body is too acidic, that is actually pro-cancer, okay? So when you study the growth of cancer, cancer grows better in an acidic environment, and it does not grow very well in an alkaline environment. Okay, so measuring pH is important, and one of them is for cancer reasons. Now, you're not guaranteed to get cancer if you're constantly acidic. Okay, it's just a risk factor. And you're not guaranteed to not ever get cancer if you're alkaline. It's just that alkalinity is more anti-cancer. Okay. So with preventative medicine, that is definitely something to put on the table with your patients is an acidic diet versus an alkaline diet, and you can go up to ORAC to help you with that. Okay, specific gravity will help you with how hydrated the person is. Okay, so distilled water has a specific gravity of 1.0. So since urine has solutes in it, it's going to weigh a little bit more. So the specific gravity of urine can be anywhere from 0.001 to 1.03. Okay, so just a little bit heavier than distilled water. So the bigger your number, then likely the more dehydrated they are. Okay, and so then if you see a very high number, you're like, well, this is indicating dehydration, you should drink more fluids. Okay, it could also indicate kidney inflammation, which is pyelonephritis. Okay, it can also indicate a kidney stone, also known as a renal caliculi. Okay, if their pH is too high. Okay, another thing you're going to look for is ketone bodies. Okay, so this is because they're either diabetic or they're consuming foods on purpose, such as the ketogenic diet, that forces them to be in ketosis. So the ketones are going to spill into the urine. Okay, you can pick up on that. But it could also mean the body may be in starvation mode. So it's going to the fat cells to pull out the components, the stored energy in fat, converting it into ketones. Okay, hematuria is red blood cells or blood found in the urine. Okay, ideally, you do not want to find red blood cells in the urine. Okay, so this usually would indicate some sort of pathology. Okay, whether it's a kidney infection, a urinary tract infection, kidney stones, okay, tumors, physical trauma. Okay, a few exceptions to finding blood in the urine, and that would be a menstrual cycle or an ultra athlete. Okay, ultra athletes, like runners, for example, for them it would be considered normal to find trace amounts of urine in the blood because of they literally pop capillaries in their body because of the way their body is impacted from the running or the whatever they're doing. So you may find trace amounts. Okay, so a couple exceptions, but otherwise you don't want to find blood in the urine. Okay, hemoglobin. If you should not find hemoglobin in the urine. Okay, the cells are likely experiencing hemolysis, so the red blood cells are breaking down. And then when that happens, the hemoglobin is released into the blood plasma and eventually passes through and you'll find it in urine. So it could indicate hemolytic anemias, transfusion reactions, which means someone was given blood, from a donor, burn victims, poisonous animal bites, renal disease. Okay, nitrites, you should not find nitrites in the urine. If you do, it might mean E. coli or other gram-negative bacteria species. Okay, could indicate bladder infection. Okay, bilirubin or bilirubinuria, if bilirubin is found in the urine, would indicate liver damage or some sort of liver pathology, whether it's hepatitis or cirrhosis of the liver. Could be a bile duct that's blocked. So the gallbladder, which is embedded within the liver, has different tubes that come out of it. And those tubes go to the duodenum. So those would be the bile ducts. Okay, so if you see bilirubin in the urine, think liver. Okay, urobilinogen is produced in the intestine from bilirubin, giving it that brown feces color. So if you find urobilinogen in the urine, then also think liver. See, so like hepatitis or cirrhosis. Okay, white blood cells are inside of us as a Pac-Man to eat the bad guys. Okay, so if you're fighting an infection, white blood cell count goes up. If you find white blood cells in the urine or pyuria, then it does mean that their body is in general finding some sort of inflammation. Okay, likely in the urinary tract or renal system, so kidneys, ureters, urinary bladder. Okay, glucose. The presence of glucose in the urine would be glucoseuria. So abnormal high blood sugar levels are likely accompanied with that, and they're spilling into the urine. So you would think diabetic with this. Okay, it could also be from excessive sugar intake. So the person might be fine, but they just had too much sugar intake. Okay, albumin is a carrier protein. It is produced in the liver. So the presence of albumin in the urine would be an abnormal finding. Your filters in the urine, your filters in your kidney are small enough to filter out proteins. So proteins should not pass through the filters. Okay, so if you're finding albumin in the urine, then something's going on because you shouldn't see protein in the urine. Okay, so it could indicate heavy metal poisoning, bacterial infection, glomerulonephritis. So the glomerulus, which is responsible for the glomerular filtration rate in the kidney, might be inflamed, or a side effect of hypertension. Okay, then after you do your visual exam, your dipstick exam, then you could do a microscope exam. Okay, so you put a sample of the urine on a slide, put it on the microscope, and you can look for things like uric acid crystals, ammonium urate crystals, calcium oxalate crystals. calcium phosphate, cholesterol crystals. Okay, really any kind of crystal formation, you can look for that. You can also look for different sediments and casts. So like finding epithelial cells, so your body for some reason is shedding some of the epithelial. Okay, your urinary bladder, for example, is made out of transitional epithelium. Okay, the kidneys have simple cuboidal epithelial cells. You can also look for the presence of your red blood cells and your white blood cells through microscope exam. Your dipstick also picks up on this. Other casts and hyaline casts are just different tissue that's leaving the body, which it really shouldn't be. This is where your microscope exam would come in. And then you make your marks. So you should have a UA sheet, and you just simply mark the things that you find. Like, for example, color. Is it a pale yellow, medium, or dark? Okay, mark what you think applies. The transparency, was it clear, slightly cloudy, cloudy? Odor, kind of the normal urine aromatic ammonia type odor, or was it like a foul smelling? Okay, what was the pH? What was the specific gravity? And then was whatever you're looking for, was it present? If yes, then in this particular case, you don't mark anything. If it was negative, then you circle it. Okay, so glucose, did not find any. Albumin, and this is just an example I have here on this person. So this person, no glucose, but albumin was present, ketones were present, red blood cells were present. Okay, no bilirubin, leukocytes were present. And then in this case, urobilinogen was present. So you just mark your findings, and all the different UA lab sheets are, have their own flow. Okay, so here's what one looks like, and other clinics might have one that looks different, but you're just simply marking your findings. Okay, then once you do that, then you would either treat them right then and there if you can, or you refer them. Okay, so since I'm not a kidney specialist type clinic, if I find enough positive findings, then I'm referring them out. Okay, if it's really bad, you know, I suspect kidney infection and so forth, then you know, we're likely going to refer to nephrologist, so kidney specialist, so they can dive in deeper to see what's going on. General practitioners can help. If it's really bad, ER can help. Okay, so, but if you have enough red flags, so it's cloudy, it's foul smelling, they already have pain over the kidney area anyway, painful urination, okay, there's blood in the urine, and you know, all that stuff. And so yes, that's going to be, they need some attention right away. Okay, any questions on any of this? All right, I'm going to share GI system. All right, so just some gross anatomy parts I'd like for you to know. So you're gonna have to either write these down or mark them. Okay. So the saliva glands, all right, so this would be for lab purposes, right? So if I give you a picture and I have an arrow pointing to different structures, just simply tell me what is the structure. Okay, so we have the parotid gland, the sublingual, which is underneath the tongue. So sub is under, lingual is tongue. okay, and then submandibular, underneath the mandible. All right, so parotid, sublingual, submandibular. Okay, pharynx, esophagus, stomach, okay, pancreas, liver. That green thing there is the gallbladder. Okay, the first part of the small intestine is the duodenum. Okay, the second part is the jejunum. And the third part is the ileum. Okay, all of those make up the small intestine. The duodenum, the ileum, and the jejunum make up the small intestine. All right, then you have the cecum, and then the ascending part. So ascending colon, transverse colon, descending colon, and then sigmoid colon. Okay, also know the epiglottis. This is the area that covers your windpipe or the trachea so that food or fluids does not get down the trachea. Also helps route food properly into the esophagus. Okay, so behind, posterior to the trachea, so looking A to P here, the first pipe you come to is the trachea, and the second one you come to is the esophagus. That's your food tube. Okay, you have the pyloric sphincter inside the stomach. So the stomach has been cut in the coronal plane here. All right, and you have the pyloric sphincter, and that is a gatekeeper for chyme, C-H-Y-M-E, which is your blender analogy. If you eat food, gets into the stomach, your stomach will blend it, churn it, that kind of thing. And then the pyloric sphincter allows for a little bit of that chyme, which is now blended food, to be introduced into the duodenum, just a little bit at a time. Okay, the different folds inside of the stomach area is called rugae. Okay, that helps increase the surface area. You can see the folds here. Sometimes we'll read gastric folds, also the rugae. All right, so it's just a different view with the liver being reflected. You can see more of the gallbladder, stomach, small intestine, transverse colon. Okay, ileocecal valve. So this is where the ileum meets the cecum. So this first part of the large intestine is the cecum. So that makes this the ileocecal valve area. So it's a sphincter, right? So when matter or waste traveling through the small intestine to get into the large intestine, that is eventually going to be passed as waste. And then this stuff has to go somewhere. So it comes from ileum, through the ileocecal valve into the ileum, okay, and then goes up or superior to on the ascending colon. All right, then this area is where the liver is. So this is the hepatic flexure. Transverse colon, which goes across. Okay, this is where the spleen is. So that upper right side is the splenic flexure. All right, so then you have the descending colon, and then the sigmoid colon to the anus. Okay, so that would be the large intestine. Okay, any questions with any of that stuff? Okay. I'll give everybody a minute to get that loaded. All right, so on the renal, okay, so it would be starting with the tubes. Okay, the red tube there, that's the renal artery going into the kidney. And the blue would be the renal vein exiting the kidney. Okay, of course, the kidney itself, kidney being shaped, that's on both sides. You have a right and left kidney. Okay, the adrenal glands that sit on top. All right, the tube that goes from the kidney all the way down to the urinary bladder, that's the ureter. And then you have the urinary bladder. Okay, and then the urethra. Okay, so those are the parts of the renal system that will be gained for gross anatomy. Okay, so kidneys, renal artery, renal vein, ureters, urinary bladder, and urethra.